Have you ever found yourself scratching the same spot over and over without knowing why? That itch you brush off as nothing could actually be your body's final whisper before a storm. This isn't just about dry skin or getting older. In fact, where your itch shows up could be a secret map pointing to deeper health issues silently unfolding inside you. For older adults, certain persistent itches aren't just annoying, they're red flag warnings from your circulation, liver, kidneys, nervous system, or even hidden nutritional deficiencies. In this video, we'll uncover the 5 specific itch zones doctors say you shouldn't ignore. Each one tells a deeper story about your blood flow, your organs, your stress levels, and how your body is trying to reach out for help. So don't skip this, because sometimes listening to your skin is the smartest way to protect your life. And if you're over 60 and serious about your health, now's the perfect time to hit that subscribe button and turn on the bell so you never miss the weekly tips that help you live longer, stronger, and with peace of mind. So, where does the body whisper first when something deeper is going wrong? Let's begin with one of the most commonly overlooked areas, your lower legs and ankles. Persistent itching in the lower limbs, especially at night or after sitting for long periods, is one of the most misunderstood signs in aging. Most people simply blame it on dry skin, aging, or even the weather. But if you find yourself frequently scratching your calves or ankles without a rash, without a clear allergy, your body might be quietly signaling, your blood isn't flowing like it used to. Studies have shown that itching in the lower legs among older adults can be linked to poor circulation, specifically a condition called peripheral artery disease, PAD. This means the small vessels in your legs are narrowing, making it harder for blood to reach the skin and muscles. The result? Not just dryness or discomfort, but over time, muscle weakness, tissue fatigue, and even higher risks of heart problems, stroke, and cognitive decline. Take Dennis, 81 years old, once a hard-working carpenter. Since retiring, he's become more sedentary. Lately, he's been scratching at his legs, especially after watching TV for long hours. He tried lotions, new socks, nothing helped. What Dennis didn't know was that his body was warning him. Blood flow to his lower limbs was slowing down. Here's the good news. When caught early, this condition can be managed, and even reversed. A few short walks around the block each week, cutting back on salty foods, and staying hydrated can work wonders for your legs, what doctors often call the second heart, because of their role in pumping blood back toward the chest. So, if you notice yourself constantly scratching your calves for no clear reason, don't brush it off. It might not just be an itch. It could be a small call for help from deep within. Itchy lower legs or ankles. A warning from your second heart. If your lower legs reflect your blood flow, then your back, especially the upper and middle sections, may be where the body speaks up when your internal filters start to fall behind. Many older adults experience a persistent itch across their upper or middle back. There's no rash, no bumps, just a deep, lingering itch, especially at night. At first, it's blamed on clothing friction, dry skin, or the fact that we often forget to moisturize our backs like we do our hands or face. But this type of itch may actually signal early signs of liver or kidney dysfunction. These two vital organs, the body's natural filters, quietly process waste and toxins. When they start to struggle, toxins can begin to build up in the bloodstream, irritating sensitive nerve endings in the skin. The upper back happens to be rich in nerve fibers, making it one of the first places to show subtle signs of internal imbalance. This is why liver or kidney-related itching often has no visible symptoms, doesn't respond to creams, and gets worse at night when the body shifts into repair mode. Take Janice, 76. She started noticing a nightly itch across her upper back. She changed her laundry detergent, tried multiple lotions. Nothing worked. A simple blood test later revealed her kidney function was declining, and with hydration and dietary changes, things began to improve. Itchy back isn't something to fear, but it is a signal worth hearing. Supporting your liver and kidneys doesn't just relieve the itch, it can improve sleep, boost your energy, and even brighten your skin. So if you find yourself scratching your back every night without reason, pause for a moment. Your body might be quietly asking you to listen, gently, but with urgency. Itchy scalp or neck. A subtle sign of silent stress and nerve sensitivity. No rash, no dandruff, no reaction to shampoo. Yet the itch on your scalp or the back of your neck lingers day after day, especially at night. For many older adults, this isn't just a skin issue. It may be one of the earliest physical expressions of chronic stress or changes in the nervous system. The nerves around the scalp and upper neck are among the most sensitive in the body. When emotional tension, silent worry, or long-term fatigue builds up over time, these delicate nerve endings often respond before anything else. This is especially true as we age, when the body's ability to regulate stress and recover from it gradually weakens. Ray, age 78, is a clear example. Since retiring, he's felt restless, struggled to sleep, and quietly carried more mental weight than he realized. What started as a mild itch in the evening slowly crept into his days. No rash, no redness. He changed his pillowcase, his shampoo, even tried anti-itch creams. Nothing helped. What Ray didn't know was that his body was signaling emotional overload, not with tears, but through the whisper of irritated nerves under his skin. This kind of chronic itching can be linked to peripheral neuropathy, long-term psychological stress, or even early signs of cognitive decline. While it's not always dangerous, it's always worth paying attention to. The good news is, the nervous system can be calmed. Gentle meditation, short morning walks, or reconnecting with loved ones. Even simple steps like these can gradually ease the itch and restore inner balance. And if your scalp is quietly asking for care, the skin on the front of your body, near your heart and digestive system, might be sending a message just as important. If you believe this information is valuable, feel free to leave the number 3 in the comments to let me know you're following along. Have you ever been lying down, resting your hands on your chest or stomach, and started feeling a subtle itch beneath your skin? No rash, no allergy, no clear trigger. It might not just be surface-level discomfort. It could be your body quietly signaling that it's running low on something vital, proper nourishment. The chest and abdominal area, rich in nerve endings and blood vessels, are especially sensitive to internal imbalances. When your body lacks essential nutrients like vitamin B12, zinc, magnesium, or healthy fats, the skin in this region may become dry, fragile, and more reactive, leading to a lingering itch without obvious cause. But it's not just your skin. Even your nervous system, especially peripheral nerves, may become overactive or misfire when you're undernourished. What's more, these deficiencies often don't show up on the scale. You might look perfectly normal, but internally, your body could be starving for what it needs to maintain itself. Take Elaine, 81 for instance. Lately, she'd lost interest in full meals, often settling for a few crackers or canned soup. Over time, she noticed a subtle but persistent itch on her belly, especially in the evenings. She tried changing her body wash, switching lotions. Nothing worked. Only after seeing a nutritionist and reintroducing small, nutrient-rich foods like eggs, nuts, and fresh berries did the itch slowly begin to fade. An itchy torso isn't always about sensitive skin. Sometimes it's a quiet reminder that your body needs to be nourished again, from the inside out. And when we begin to listen to signals as gentle as these, we don't just live longer, we live deeper, more present, and more fully every single day. Itchy chest or abdomen, when your body runs low on the fuel to heal. Most recently, a health bulletin titled, "When Itching is No Longer a Minor Issue," has become the focal point of attention in the latest health news. Itching is a common symptom, often dismissed, especially among older adults. However, health experts warn that the location and nature of chronic itching may serve as an early warning sign of more serious internal health issues. For instance, persistent itching in the lower legs or ankles without any visible rash can indicate poor circulation, potentially linked to peripheral artery disease, a condition that raises the risk of heart attack or stroke. Meanwhile, itching in the upper or middle back is frequently associated with declining liver or kidney function, particularly when it occurs at night and does not respond to topical treatments. Another area worth noting is the scalp and back of the neck. Chronic itching in these regions, when not related to dandruff or shampoo, can reflect long-term stress, mild nerve dysfunction, or even early signs of cognitive decline. Additionally, itching around the chest or abdomen may be a sign of nutritional deficiencies, such as a lack of vitamin B12, zinc, or essential fatty acids, which can affect both the nervous and immune systems. While not every itch is dangerous, persistent, unexplained itching that doesn't respond to regular remedies should not be ignored. The body doesn't always cry out in pain. Sometimes it whispers through the skin. Don't overlook it. Let your body's signals become your starting point for better care, from the inside out. There were days when I caught myself scratching the back of my hand for the third time in an hour. No rash, no irritation. My skin looked perfectly fine, but the itch was persistent, like a soft knock on the door that wouldn't go away. Itchy hands and wrists. When your nerves speak before the diagnosis. Itching in the hands and wrists, especially when there's no visible rash, is often dismissed. People assume it's just dry skin or a reaction to soap, but in reality, it can be an early sign of peripheral neuropathy, often linked to pre-diabetes or type 2 diabetes. The nerves in our hands are highly sensitive, and even slight shifts in blood sugar levels or circulation can cause strange sensations, including itchiness, tingling, or a burning feeling. At first, the symptoms are subtle, often showing up at night or after sitting too long, which leads many people to overlook or ignore them. Mr. Gerald, 69, is a clear example. He began to feel an itch on his wrists while watching TV in the evenings. Thinking it was just dry winter skin, he brushed it off. But after weeks of persistent itching, accompanied by mild numbness and constant fatigue, he saw a doctor. Blood tests revealed elevated glucose levels, a warning sign of pre-diabetes, and early signs of nerve damage. The good news? Pre-diabetes is often reversible when caught early. Gerald began walking every morning, cutting back on sugar and refined carbs, and eating more fiber-rich foods. Within 2 months, the itching had stopped, and he reported better sleep and improved energy levels. Itching, especially on the hands, isn't always just about the skin. Sometimes it's the nervous system's first attempt to get your attention before something worse begins. And if a sensation as light as that can carry such a message, perhaps it's time we all learn to listen to our bodies again. Starting with the smallest signs. And perhaps, after all these silent signals from the skin, what truly matters isn't where the itch appears, but how we choose to listen. Listening to the smallest signs. As we reach a certain age, we begin to understand that our body no longer speaks in loud, urgent tones. It doesn't shout like it used to. Instead, it whispers through the tiniest sensations. A little soreness in the legs, a restless night's sleep, or just an unexplained itch that won't go away. The itches we've explored together, on the legs, back, scalp, abdomen, and hands, are more than skin deep. They are gentle messages from within, urging us to slow down, take care, and not ignore the signs our body so patiently sends. We don't live to count the years. We live to feel every day clearly and fully. And sometimes, the smallest changes, a 10-minute walk in the morning, one more glass of water, or a simple phone call to someone you love, can soothe not just the itch, but the deeper silence underneath it. I don't expect you to remember every detail. I only hope that the next time your body speaks, even in the faintest way, you won't be too quick to brush it off. And if this video made you feel seen, heard, or simply not alone, I truly hope you'll return next time, like an old friend, as we continue this journey of caring for our aging selves with wisdom and compassion. Because it's never too late to care for yourself, and you're never too late to start listening. A gentle note. If you're looking for the right next step, you've been experiencing persistent itching with no clear cause, especially without rashes or visible irritation, please don't ignore it. It may be your body's way of starting a conversation. Don't hesitate to consult a dermatologist or primary care doctor if the itching lasts more than 2 weeks, especially if it comes with fatigue, weight changes, poor sleep, or shifts in your mood. Sometimes a simple blood test is all it takes to uncover something your body has quietly been dealing with. At home, you can begin with small steps. Drink plenty of water every day. Cut back on spicy, salty, or sugary foods. Use fragrance-free, gentle moisturizers. Take 10 minutes each morning to breathe deeply, go for a light walk, or simply sit quietly with yourself. And most importantly, you don't have to go through this alone. An itch isn't just a small thing if it's stealing your sleep, your peace, or your smile. Listening and responding early is always better than waiting. I hope you stay well and remain gentle with yourself. If something in this video made you pause and reflect, please leave a comment. I truly look forward to reading your thoughts, because sometimes someone else's story can be the light another soul has been waiting for. And if you feel this is a safe space to learn how to listen to your own body, feel free to subscribe and turn on the bell so you won't miss anything meaningful when we return. If you know someone who may be quietly going through the same signs, please share this video. Just 1 minute of listening could bring peace for years to come. Thank you for staying with me until the very end. We'll meet again. Like old friends, walking side by side on this journey of learning to care for ourselves with love.